Thank you. I'd recognize the gentlelady from New Mexico, Ms. Wilson.
Thank you, Mr. Chairman. I will pass and reserve my time.
Gentleman from Indiana, Mr. Boyer. Okay. Gentleman from Pennsylvania.
Oh, wait.
Okay. The gentleman from Pennsylvania, Mr. Murphy.
Thank you, Mr. Chairman, for holding this important hearing for a group of Americans who too often are forgotten. We're here today to discuss the important role that Medicare plays in providing care for people with disabilities. It gives vital support for the 10 million individuals it serves. This includes the elderly who have physical disabilities and those that suffer with mental illnesses and intellectual impairments. In my 25-plus years of practicing as a psychologist working with many children and families, I know firsthand the importance that Medicaid provides to those who struggle with mental retardation, autism, serious mental illness, physical disabilities. Over those years, I've treated many starting in their infancy when their disabilities first began to take note. I worked with them as they faced a system that has been best characterized by barriers, bureaucracy, and battles, when it should have emphasized independence, not more dependence. It should have provided more in terms of support and services for self-sufficiency and not more walls that keep people from being able to hold jobs or work in their communities. Community-based services increase people's quality of living, but we know it's also more cost-effective, and I hope to learn more about that today. With the thousands of patients and families that I have treated, I have learned that nobody gets better by being denied services, and no disability is ever treated effectively by being put on a long waiting list. We have to have home-based care that's effective, it saves money. Between 1999 and 2002, the average nursing home payment rose 13%, but in contrast, the average cost per home-based patient rose just 2.2%. That's not effective. Medicaid reimburses nursing homes between $35,000 and $75,000 per patient per year, and we hear from nursing homes that's often not enough to cover their care. But even so, compare that to only $25,000 for the average home-based care patient per year. That's not effective. Texas estimated, understand, it saved between 20 to 35% in state Medicaid spending, thanks to beneficiaries transferring out of nursing homes and into home care. And I'm pleased that Medicaid has shifted resources towards helping community and home-based care. The percentage of Medicaid funds available to these programs has doubled from 15% in 1992 to 36% in 2004, and is probably able to provide more access to community services. With that said, I'm also pleased that Three Rivers Center for Independent Living back in the Pittsburgh area provides such excellent services. But my guess is a couple are here. But there's more we need to be doing effectively. All of our hearts go out in compassion to helping those who struggle with the barriers of their disabilities. But we must do more than offer our hearts. We must also work with them, because many of them are able to provide great ideas of how we can be more effective as government working with people, to do what Abraham Lincoln once reminded us, that government should do that which people cannot do for themselves. Not to increase dependency, but to work effectively with them so that they can become more independent, more effective members of our community. And I yield back.
Thank you.